Why we did this presentation or why we did this work is because patients with brain metastasis presents a very heterogeneous patient population. We have different primary entities who can cause brain metastasis, so we see varying clinical characteristics depending on the primary origins, but we also see different and varying clinical characteristics within the same primary entity, and therefore it's so important to accurately define patients' cohorts in order to understand the clinical courses and to improve the prognosis. The presence of extracranial involvement has already been postulated as a significant prognostic factor. However, we observed an increasing incidence of patients diagnosed with brain-only oligometastatic diseases, so the brain metastasis as the only metastatic lesions in the whole body over the last years, raising the question how to define oligometastatic disease in terms of ZNS involvement. That was the aim of our presentation or our work to classify and define patients with brain-only oligometastatic disease in order to refine the patient selection for treatment strategies and clinical trial planning. In our large real-life cohort of around 6,000 patients, around 40% presented with brain-only oligometastatic disease. In detail, around 21% presented with a single brain metastasis as the only metastatic lesion, while around 18% presented with two or more brain metastasis or multiple brain metastasis oligometastatic disease. In the total cohort, lung cancer and cancer of unknown primary were the most frequent primary tumors or regions causing brain oligometastatic disease. We saw varying clinical courses according to treatment strategies. Patients with single BM oligometastatic disease were rather treated with neurosurgical resection, while patients with multiple brain metastasis oligometastatic disease were rather treated with stereotactic radiosurgery. Importantly, no matter if we have one brain metastasis or more brain metastasis, as long as it's an oligometastatic disease, we see a significantly improved overall survival compared to patients with additional extracranial involvement. And we also see a higher percentage of patients surviving longer than 2 years. It's almost doubled compared to patients with extra and intracranial involvement. So it's very important for us in future to take an individual treatment approach in patients with brain metastasis. We can't put all patients in one pot, and also aim a multidisciplinary treatment approach in order to address this high proportion of patients with a significantly improved and longer median overall survival.